to the video series about diabetes and improving resident outcomes in long-term care, presented by Superior Health Quality Alliance. This video was developed for healthcare workers with an interest in providing care to individuals with diabetes residing in a long-term care setting. This video will address strategies about the importance of transitions of care. You may watch each video in order or based upon your interest. The objective for this learning session is to achieve the following: identify key best practices in transitions in care on patient outcomes. Our goal is that after the video, you will have a better understanding of this topic and how it applies to your own healthcare setting. Some foundational aspects in transitions of care are the transitional teams. Part of this transition of care work is measuring and tracking data. Anyone in quality should know that unless we measure, how do we know we're making a difference or an improvement or achieving the desired outcome? Transition teams assist in comprehensive discharge planning. Medication management is huge, no matter what transition you are doing: hospital to nursing home to home, or nursing home to assisted living. Medications can easily lead to errors, even with the use of an EMR. It's important that the pharmacist, physician, and anyone on the receiving side are aware of what the patient is truly taking. Patient and family engagement and education are crucial because they need to participate in their care and understand their care needs. This includes whether they need to be transferred. Sometimes patients and families feel their loved one needs to remain in a hospital, but that can add potential problems. The care they're receiving might be right and appropriate, and their loved one is doing well. Staff education is always very important. In addition to communication and transitions of care, coordination is essential. So I did some research. I was really trying to find the best practices proven in studies or retrospective reviews as to what should be included in a great transition of care. Whether it would be from a nursing home back to home, or whether it's a nursing home to home with healthcare. Unfortunately, there really hasn't been much done in this area, which is disappointing. The complexity of this patient population makes it challenging for studies to identify a clear and consistent theme or model. The best I could do was find some quality care outcomes that can happen following transitions of care interventions for older people when they go from the hospital to home. Quality care outcomes following transitional care interventions for older people from the hospital were studied, and the key findings were significant. Comprehensive discharge planning can only happen if everyone is involved. Complete and timely communication of information, including medication reconciliation, is crucial. Have you ever sat in on a discussion between the nurse and a resident during discharge? This is an opportunity for education in improving the discharge planning process. Teach back is huge, keeping the patient at the forefront and involving their input in the discharge process. Another study proves that open communication between all providers and caregivers is important, along with prompt follow-up. While this is more on the hospital side, it is equally important when a nursing home is discharging a patient home. Making that phone call to check in on them is vital. If it's important to ensure they have a visit with their primary doctor, then make that phone call and do a soft handoff. All of this improves the outcomes for the patient. I interviewed a woman who spent many years in leadership with a home healthcare organization, and this is the information she thought was most beneficial. Up-to-date health records are considered crucial, and this includes an accurate medication list, including the dose, immunization records, last lab results, and the results of the last doctor appointment, especially if they were seen outside the nursing home. They need to know if the patient is newly diagnosed with diabetes, because this will impact the education and other types of care services needed. And can the patient manage their disease? Are they able to check their blood sugars and take their medications, or give insulin injections? Assess whether they can do these tasks. What are the patient and caregiver educational needs? Lastly, consider any complications they may have, such as wounds, healing issues, numbness, muscle weakness, or imbalance. All of these types of complications are important to note. Key takeaways and resources. In summary, here are some key takeaways from today's presentation. The transition process should always keep the patient at the forefront. Their input is very important. It's a team sport. It's dependent on both organizations and all caregivers. All members of the transition team need to be involved, as each play an important role. And lastly, communication is key. We have created a list of tools and resources that may be helpful to you to explore further what we have been talking about on this video series. We have provided the following resources related to diabetes care in a long-term care setting. However, care transitions can be used for any individual, not just those with diabetes. We would challenge you to ask questions about diabetes care management in your own healthcare setting. Where are the gaps? Where are you seeing gaps in processes? Are your residents experiencing hyper or hypoglycemic events? And what steps are you taking to prevent them? All of these questions can lead you to the development of a root cause analysis, action planning, or initiating a Plan, Do, Study, Act cycle. We challenge you to analyze your data and determine where there are opportunities for improvement. Here are additional evidence-based journal articles that have information and additional resources included in them. If you have questions about this video series or others, please contact us at info@superiorhealthqa.org. Thank you.